All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So the cool bean said one more show is fine instead of another show. So welcome to one more show. The discussion today is interesting. There is a study in Nature Medicine. It is from UK. Beautiful study, huge size, 38 million people. It's an study, prospective study, looked at their records after their vaccinations for pericarditis, myocarditis, and so on. Sorry, I'm still getting ready. And overall, they found that the risk of pericarditis and myocarditis is more in COVID infected people than vaccines. However, there is a part of that study which is really important under age 40. The risk from BioNTech's second dose was higher in men under age 40, even more than the COVID infection. And this is one part that they showed it in the data. But when articulating it, they really were very um, tactful about it. So I wanted to make sure that we look at the study, we look at the data, and we look at how they presented that data or how they narrated it. There is one more important thing to note, and that is that adenovirus based vaccines, so that is the CHAdOX1 or Oxford AstraZeneca, that had more myocarditis under 40 for women. So that is an important one. Although I believe that there is the clotting issue that also is related to these for women under 40. I would believe even under 50. And I feel that for adenovirus based vaccines, we should really think again, considering their, at least with the Johnson and Johnson, for example, which is not part of this study. Johnson and Johnson, remember in the US, the CDC says get a booster after 2 months of the Johnson and Johnson. So the efficacy has a problem. Overall efficacy generation has a problem. The durability of efficacy is a problem, and the side effects and clotting is more in women. I think that Johnson and Johnson like vaccines may need to be rethought. And overall, I believe all the vaccines at this time need to be rethought about the design. And Luffy has joined us discussion in our discussion as well. So let's start. I didn't do a lot of drawing today because I just woke up and all right. So here is the study, the references. Here's the study: risk of myocarditis, pericarditis, and cardiac arrhythmias associated with COVID-19 vaccination or SARS-CoV-2 infection. So they didn't say in the title here that more or less, because there is a lot of data in here and not everything can be put in the title. The second part, this is the graph that I would like to go over in another minute. And then this is some ways that media has treated it. For example, here, myocarditis risk from COVID-19 vaccines are still less than the risk from COVID-19. You would see that they would continue. Again, how many things they can put in the title, I understand that. Even how many things can I put in the title? How many clarities can go in a title? Still, the important thing is, look, the risk lesser than COVID, fine. We already know that. What is more important is to start guiding people to say, hey, guys of this age and gender and sex, gender and sex is the same thing, this age, please, you take this kind of vaccine versus you take this kind of vaccines. That is the wisdom and selectivity that should be offered. And it would not actually, as we here in the US, our healthcare authorities believe that somehow that would confuse people and make it more difficult for them to make a decision. It would actually help them make a decision. They would say, well, I am 40, I'm a man under 40, this vaccine does this, I would rather go take this one. They would feel more confident with that kind of data. Anyways, so this is one here. This is the Reuters, higher risk of cardiac heart complications of COVID-19 than vaccines study. So this is true. But again, I think that the focus should be on those at risk so they get alerted and they do the work to figure this out. This is another study that I would discuss at a different time. This is Moderna COVID-19 shot likelier to cause heart inflammation than Pfizer study. So here, Reuters, this study that I'm going to discuss also has the same thing, that Moderna's risk under 40 years of age, men, is higher than Pfizer and higher than the COVID. But they didn't articulate it. But here, because these were two vaccines, they did articulate that. I'll discuss the study at a later time. Again, I'm not blaming the media here. I understand how many things can they put in the title. I struggle with this as well, that what do I put in the title? So let's look at this study. Very interesting. And I'm going to go over my presentation part of it. So I hope you are all doing great. This is a nice weekend. Today is Sunday. Happy Sunday, and let's start. So I want to start from here, from this chart, and I want to show this chart on their site as well. Again, full credit to them for this. Look at this. What they're saying is the following. And if we understand this chart and we are careful here, then the rest is all interesting. The leftmost chart is myocarditis overall, regardless of the age, sex, gender, whatever. Sex and gender, same thing, right? Myocarditis. Here down here, this is the very first column is Oxford AstraZeneca. The second one is the second dose of the AstraZeneca. Then the third one is Pfizer BioNTech first dose, second dose, and then the Moderna first dose and second dose, and finally COVID itself. So as you can see, overall, the Pfizer and Oxford has negligible um, possibility of cardiac myocarditis. Moderna, first dose and then second dose, have myocarditis possibility. And what is that? If you see here, after the first dose, about 8, and after the second dose, about 10 excess events per million people. And if you look at SARS-CoV-2 over here, 40 excess myocarditis per million people, or heart problems. That could be myocarditis and other things as well, but myocarditis in this case. So this is the chart that is being used by media and everyone to say, hey guys, the COVID causes more myocarditis compared to the vaccines. Fair enough. That is here 38 million people's data. It's a large study and it is a good study. They're not fudging the data, they're not making it up. This is good data. Now, and this is coming from UK. On the myocarditis under 40, this is what I would like you to see. This is under 40, men, women, both. Although in the discussion they said second dose of Moderna, men have a higher risk. So here, Oxford first and second dose, no risk of myocarditis. Under 40. So shouldn't we actually say that, hey guys, if you're under 40, please choose Oxford. And if you're a woman, then don't take adenovirus at all. So even if they're under 40, adenovirus is going to cause clotting. Then BioNTech is the second one. So over here, once again, this is, I think, about 4 per million, or 2.5, I think 2.5 extra cases per million of myocarditis in under 40 after the first dose of Pfizer. After the second dose of Pfizer, about 3 maybe per million, 3.8 per million excess cases. Then look at BioNTech. This is important. And again, we're talking under 40. I keep repeating it. My apologies, but this is what I want us to take away from the whole discussion. Under 40, Moderna first dose is about 8 excess cases of myocarditis per 1 million. And look at the second dose here. Second dose, 15 excess cases per million with the Moderna second dose. Compared to COVID is next 10 extra cases per million if they get COVID. So if people get COVID, they're under 40, there are 10 per million who would develop myocarditis. But if they get the second dose of Moderna vaccine, under 40, second dose, they get 15 excess cases of myocarditis. If we do something that sometimes vaccines researchers do, they say percentages 1.5 times. So this is the 150% or 1.5 times. This is important for me. Why this is important? Not for the fear mongering part of it, but the importance here is that people under 40 maybe should prefer a different vaccine. And that is not a bad thing. How many vaccines are there? We have 3 vaccines. So how complex and difficult it is, how discouraging it is not. If you said, hey guys, under 40, please avoid Moderna. Or if you're going to have, I wish that there was a mix and match as well to say, hey, first dose Moderna or BioNTech and the second different. Anyways, this is the important chart. Then this is the pericarditis. So pericardium is the layer around the heart in which it is kind of sitting, and that layer is filled with fluid. So it provides a lubricated surface for the heart, a lubricated container for the heart in which heart is moving all the time. So pericarditis can become inflamed as well. And if you see here, that is only showing for COVID. And then arrhythmias can occur as well, heart rate becoming fast or slow. And if you see here, COVID caused arrhythmias are much higher. If you see here, this is like 2,200 cases per excess cases per million versus Moderna second dose, which is somewhere down here. I can't even know the numbers. So the takeaway is right here. The takeaway is under 40, please be careful with Moderna. If you can take a Pfizer vaccine, then take it. At the same time, the data that is missing in here is the death. I think they did not see death with the myocarditis, but I cannot say it because that data is not here. Now I'm going to go back to some interesting points from this study as well, which are the way. So this is it. This is the takeaway done. Now let's see how, in some cases, the researchers narrated the comparisons. So now I hope this is in your mind that under 40, second dose of BioNTech, Moderna, not BioNTech, Moderna, more cardiac myocarditis compared to even COVID. So if under 40 people got COVID, they have less myocarditis chances or events, excess events, compared to second dose of Moderna. Correct? So keep that in mind, please. Now I'm going to go over some of the interesting ways. Risk found an excess in myocarditis. So the excess risk was observed in men and women, but was only consistently observed following both mRNA vaccines in those younger than 40 years. Although this may in part reflect a small number of individuals over the age of 40 years receiving mRNA vaccines, or at least 1273, which is Moderna. So one reason, and this is totally fair, if the number of people who got it less, I hope that they are doing per million. And if they are doing per million, then this kind of risk assessment should go away because they're looking at per million. Women. In women, we found an increased risk of myocarditis 1 to 28 days. So this study was after the vaccine first dose or second dose, and then 28 days till after that, or COVID and 28 days. So 1 to 28 days following a first dose of CHAdOx1, that is Oxford AstraZeneca, and BioNTech, that is Pfizer, and following SARS-CoV-2 positive. So in women, we found an increased risk of myocarditis following a first dose of Oxford and BioNTech. So that is also an interesting point to keep in mind. And of course, SARS-CoV-2 positive as well. Under 40, they say the increased risk of myocarditis associated with either messenger RNA-based vaccine consistently occurs in the younger population. So this is that graph, the second graph, and they're saying, hey, under 40, there is a consistent occurrence of myocarditis. So fair enough. Then they say here, in the 1 to 28 days following the second dose of mRNA 1273, Moderna, an extra 10 myocarditis events per 1 million persons would be anticipated. Now, do you know this extra 10 is compared to what? This is extra 10 compared to COVID. I think so. Hold on. This was second dose, an extra 10. This compares with an extra 40. Now, here is the interesting part. This extra 10 under 40, they're talking under 40. This compares with an extra 40 myocarditis events per 1 million in the 28. Or I may be actually, sorry, so this is still not under 40. My title is wrong. So here, with the second dose of Pfizer Moderna, there is an extra 10 excess cases overall, not 40. And then the 40 is the COVID. So this under 40, this title here is wrong. Okay, risk assessment. We estimate that absolute number of access myocarditis events in 28 days following a first dose of adenovirus or mRNA vaccine between 1 and 6 per million persons vaccinated, and the excess risk following the second dose is 10 per million, right? So 1 to 6 excess to 10 per million, overall 40 for COVID. The risks are more evenly balanced in younger persons aged up to 40 years. Here, I feel that they should have done something else. But let's look at the overall paragraph, where we estimate the excess in myocarditis events following SARS-CoV-2 infection to be 10 per million, with the excess following a second dose of Moderna vaccine being 15 per million, compared to over here, there could be an extension of the sentence saying compared to COVID, which was 10 per million. That part is gone. But if you see the other narrations where it is compared to COVID, the vaccine, then it is said clearly. But in this cohort only, COVID is 10 per million, and that is not written like that. So here, I'll read it again. The risks are more evenly balanced in younger persons aged up to 40 years. So they're talking about this diagram and here. They're saying here this is more evenly balanced. Although I don't believe it is evenly balanced, because look, 2.5 or 3 versus 10 is not evenly balanced. This may be the Moderna's one dose, which is about 8 versus COVID 10, that may be evenly balanced. If you look at Moderna's second dose, 15 versus COVID 10, that is not evenly balanced. So this could have been highlighted. And they highlighted that they should be, look, in myocarditis event following SARS-CoV-2 infection to be 10 per million, with the excess following a second dose of Moderna vaccine being 15 per million. Further research is required to understand this. So anyways, they have given it. Further research is required, although, so this is a part which I think they did right here. Although the wider societal benefits of controlling the spread of virus to those who are more vulnerable are substantial, these data may help inform public health policy and the choice of vaccine offered to younger adults. So the choice of vaccine for younger adults is the message actually. So they know that, hey, we should say that maybe think about Moderna under 40 to be more careful about that. So that was my only criticism down here, that this could be a little more clear. Anyways, now outcomes and observations. They say that the outcomes were identified as the first hospital admission due to event of interest or death recorded on the death certificate with the International Classification of Disease 10, correlated to the outcome of interest within the study period. So study period was their time during which they did the study. They observed people from 1 to 28 days after, and they looked at the data. So this was not direct contact with people, this was hospital data. Total vaccinated, so some more details. About 38 million are vaccinated in UK. The Oxford AstraZeneca 20 million, Pfizer 16 million, and Moderna 1 million. Moderna's size overall is less as well. That was the first dose, one dose. Two doses. Oxford 19 million, so almost 95% of the people, or 96% of the people who had Oxford have gotten both doses. So 20 million. BioNTech 11, so 70% have gotten the second dose as well. And Moderna 36%, they are still either going to get the second dose with Moderna or they'll go for Pfizer. So this may be a good guidance over here for the people who have taken Moderna to say, hey, if you're under 40 and Moderna second dose is seen to be a little more towards the cardiac imbalance, then maybe take Pfizer or Oxford. I do not prefer adenovirus vaccines based on the studies for women under 40. Now, vaccinated and COVID plus, amongst those with at least one dose, there were 3 million. This is the data I was looking for yesterday, with the day before yesterday's study. So here is the data. the question is how many people who are vaccinated and have infection, or how many infected had vaccine as well. So they had this data, so I thought I'll share it with you. Amongst those with at least one dose, there were 3 million individuals who had a SARS-CoV-2 positive test. So remember, one dose about 38 million. So amongst them, there are about 3 million that were positive as well for infection. Remember, in UK, there are 11 million positive cases. Of these, 2.3 million individuals tested positive before vaccination. So this is the 2.3 million out of these 11 million who became positive and then they got the vaccine as well. So 2.3 million out of 11, about 24%. And 298,000 tested positive after the first and second vaccine dose, respectively. So about a bunch who were infected and then they got the vaccine, and then there are some who got the vaccine and then tested positive. So that is very interesting because it plays into the discussion yesterday that we had, and that discussion was um, South Africa's immunity level being higher, and I was calculating UK's immunity level, and I was seeing that UK has, if we use the same formula as South Africa, where UK's healthcare leaders said South Africa is 70, 80, 90% immune. And that means they use their vaccination plus their infection as well. Although I doubted that South Africa has 60% people who got the infection and recovered. But anyways, that's what they implied when they said 90% protection. If we use the same formula for UK, then that would mean out of the 11 million, now we can see that 2 million, or sorry, 3 million are also vaccinated. And then out of 11 million, there are 2 million who were previously infected and then got vaccinated. So let's reduce the 11 million to 9 million. So 9 million infected and recovered, remaining 38 million one dose vaccinated. So we saw 75% in our world in data, but this study says 38 million. So 38 million plus 9 million is 47 million. That is the protection level at least. And this does not count those who may have asymptomatically recovered. So UK, and this does not count children that have lesser risk. So there is a good protection in UK as well. We'll keep praying that something bad does not happen with Omicron. And there is holiday season, there is Christmas coming up, the New Year's coming up. I hope people stay safe and protected and happy and healthy. So I hope data stay this way. I have no wish in my heart that somehow the data becomes bad and we learn a lesson from Omicron. I wish Omicron becomes positive for humanity at this time and it stays that way. Okay. So with this, thank you very much. Let me just very quickly see if what are the things here. For your solution, Colorado, there's nothing wrong with the volunteering experiment. A lot of people deny freedoms. How do we know these are not from also rare occurrences of invert? So Leda says, how do we know this is also not the rare occurrence of the inadvertent intravenous injection? So I know that somebody has made this mainstream that this is that. So we don't, just like we do not know. Actually, I left this reminds me, there is one more, I believe. So hospital stay was 2 to 3 days compared to normally if a person goes to hospital because of other reasons but has myocarditis, for example, heart attack, they stay in the hospital for 7-8 days. So this hospital stay was less. And this your question, Leda, they said in the study, whilst the mechanism of myocarditis following exposure to SARS-CoV-2 infection and vaccination are not known, it seems likely that systemic complications of infection are a consequence of an immune-mediated virus-independent immunopathological process. However, vaccine-mediated expression of SARS-CoV-2 surface spike protein on the surface of cardiomyocyte could potentially trigger an immunological response resulting in organ-specific cell death. So they said maybe the vaccine triggered spike protein, which I think is an incorrect way of looking at it. The other one is autoimmune. That is possible. The rare cases of intravenous or somehow intravascular injection, that has the following issues. And if you believe in that, and if you want to ask that, hey, please aspirate, please by all means do it. It's not a hugely difficult thing to do, to say please aspirate and then do it. However, if you look at the data, Oxford doesn't do it, BioNTech doesn't do it, Moderna does it under 40-second dose with a higher incidence in men specifically. So all of those cannot just be the coincidences to say this extra intravenous injection happens for Moderna, for men, for under 40 after the second dose. So maybe that is how it is. But anyways, if we conclude that one to say want to have aspiration, then sure, that is fine. In my belief, the most important part here is the autoimmune or the mimicry. Many viruses cause myocarditis because they can cause mimicry, or autoimmune system or immune system can attack our own heart. So with this, thank you very much. And let's break for today. And we'll meet again tomorrow. So please like, subscribe, and share. And if you would like to support this work, there are 3 links in the description. You can buy me a coffee or become a patron, or you can use PayPal. Thank you very much, and I would see you tomorrow. Have a nice weekend.